The Victorian Parliament's inquiry into end-of-life choices continued with a hearing in Geelong on 29 July. A range of healthcare professionals from the Barwon region spoke to the committee about issues surrounding end-of-life care.
I think the funding model is outdated and probably needs to be a bit more patient-centred rather than service-centred. And I think some of the legislative changes to empower community members to have choices and to be able to document those choices.
Medical Director at Barwon Health's Intensive Care Unit, Dr Neil Orford, stressed the importance of communicating with patients and developing an end-of-life plan.
So the key issues are around end-of-life care in the hospital system where I work, and how with patients who we know are at risk of dying in the following year, talk to them, listen to them, and then come up with a plan for them for what they want the next year to look like.
Other themes centred on integrating services and the funding and provision of palliative care in rural and regional areas.
I think there are a few areas, particularly around qualified specialist palliative care staff within the rural and remote areas. Specialist physicians, specialist nurses. It's particularly difficult to recruit and retain those types of positions within a rural area.
Well, certainly one of the main areas of discussion today was that it's time now for state and federal governments to back regional decision making and adopt a process and through their policy developments together to enable regional organisations to work with local communities and local clinicians to come up with more responsive and targeted, more efficient solutions to healthcare needs.
Committee Chair Edward O'Donoghue said it was important for the committee to learn about community responses to palliative care issues in country and regional Victoria.
We heard about how the community works together here in Geelong, and one of the reasons why the committee is keen to get out and about in country Victoria and regional Victoria is to see how different communities respond to the challenges and respond to the opportunities that may exist by sharing services, by working together in this very complex and challenging area of palliative care.
The Legal and Social Issues Committee is assessing current practices being used within the medical community to assist people with managing their end-of-life choices. The committee is also reviewing current legislation around this issue from other Australian and overseas jurisdictions. It will consider what type of legislative change may be required and will report back by May next year. Further hearings are scheduled for Melbourne and other Victorian regional centres.